Welcome to Red Flags with Elissa.
Welcome back to Red Flags with Elissa. I'm your host, Zofia Morales, and we're diving into another exciting episode alongside our expert, Elissa Brewster. In this episode number 3, titled Behind the Medical Spa Numbers, How Physician Ownership Changes the Revenue Game, we'll uncover the crucial financial and legal dynamics that come into play when it comes to physician ownership in medical spas. Elissa, thank you for joining me here today.
My pleasure. Thanks again for having me.
Oh, we always get such amazing information when you're here with us. So to start, can you explain the legal requirement of a physician being a 51% owner in a medical spa? Why do we need this, and what does it mean for partners and investors who are not physicians?
Sure, absolutely. So within the state of Texas, we have what is called or normally known as the corporate practice of medicine doctrine. Okay. What essentially that does, or what that means, is that we do not want corporations making medical decisions for patients. Those are things that physicians and other medical professionals need to do. Okay. And so with a medical spa, if it is owned by someone, majority owned by someone who is not a physician, then that person could actually be practicing medicine without a license.
Oh, that would not be cool.
That would not be cool.
That would be very not cool.
Yes.
So obviously you're going to need a physician who's a 51% owner.
Yes.
Why is the 51% significant in terms of ownership percentage?
Sure,
Explain that to me.
So 51% is the minimum amount that a physician can own because it needs to be majority owned by a physician. Okay. So if you want to have something that's 70-30, that's perfectly fine. If you want to have something 60-40, that's perfectly fine. But on the minimum amount that physician can own or that non-physician can own is 49%. And the physician would be the other 51.
So what I'm hearing is they need to have that majority vote, the ability to override other partners if they need to do that to keep it on track.
It's not like a majority vote, like in a traditional corporation, right? Where you have all these different partners, but it has to be run by a physician in order for that physician to practice medicine.
Okay.
So if you have 4 partners, then that physician has to be the 51%, and then the other 49% we can divide amongst the other 3 partners, unless you have 4 physicians that want partners, and then that can all be 25% or whatever because it's physician owned. What we're trying to avoid is to have a non-physician owning and dictating medical treatment and diagnosis. We need that to be run by a physician.
So does that division of ownership also dictate the revenue split that comes when you're working in a spa like this, or how does that work?
Not at all. And that's one of the most complicated and common questions that I get. I tell people all the time that the ownership does not equal the revenue. Okay. So the example that I typically give is think of a bakery. And so if you and I were going to open up a cookie store and you have the recipe and I have the money, which is more valuable, right? You still need the money in order to get the cookies going, but we still need your recipe. And so think of it more as that the physician has the recipe, right? We need that physician in order to be compliant with the corporate practice of medicine doctrine for Texas. And then also we can split that equity however we see fit. As business partners, we can say, you know what, Elissa, pay me in Skittles, or you know what, Elissa, pay me in puppies. Like, it doesn't matter as long as you and I agree to whatever that split is going to be. And sometimes that could mean that the physician is not putting in any money and that the nurse or the non-medical investor is putting in $15,000, $20,000, $30,000 or what have you to get it going. That split does not equal the percentage of ownership. The percentage of ownership is only really to demonstrate to the state of Texas and other CPOM states that you're compliant.
Okay. So kind of it's an open field on how the revenue is split down the road, just
Yes.
based on what you and your partners agree to then.
Yes.
What are some of the common misunderstandings about physician ownership in a medical spa, and how can you avoid some of the pitfalls that come along with these misunderstandings?
I think one of the biggest misunderstandings is that that physician partner is going to take 51% of the revenue. That's
Right.
probably by far the biggest question that I typically get, and really having to walk people through and explain that. And I really take my time with that because it is really important, not only for the physician to understand, but the non physician, whether it's a nurse practitioner, an RN, or just a regular person, for them to understand what's all involved. The physician is putting their medical license on the line,
Oh,
right?
yeah, it's a significant risk.
It is
Yeah.
a huge risk, which is another reason why they have that 51%. I would say that a really good operating agreement, which I would highly recommend for anybody doing any kind of business, an operating agreement is going to be your blueprint of what's going to happen. I live in the zombie apocalypse, the sky is falling world. Like
Yeah.
that's just the world that I exist in. And so that operating agreement is going to be able to provide framework and a blueprint if something happens. That's like the biggest question. Well, what if the physician doesn't want to do it anymore? Well, then you're going to need to find another physician.
Yeah, exactly. And so the operating agreement spells out, yeah, notice time and all that kind of stuff. Yeah.
And how to split the revenue, right? Like that's also something that's going to be in that operating agreement. How are we going to split the revenue for that physician and the non-physician? Maybe that physician is only going to receive the monies from the other contracts, because with medical spas there's a series of contracts that have to happen in order for it to be compliant. I like to
Mm.
call it hopscotching or leapfrogging, because that to me is what makes the most sense. It's not this linear, most contracts are linear, right?
Right.
Or horizontal between two or three parties. This is really, we got to form the med spa that has
Right.
to have the 51% ownership. And then the med spa is going to contract with that physician in order to do those good faith exams, because only a physician, and there are
Can do
exceptions
it.
to the rule,
Yeah.
but a physician can do that. And a physician is going to get paid for doing that. And then the med spa is going to contract with that physician again to be the medical director. And
Mm.
that typically is at a flat fee. We don't want to do anything that is going to raise a red flag
Yes.
for anti kickback violations. And so if we do this in such a way that we're very mindful of all the different contracts that need to be done, then you can have a successful med spa.
Wow, that's a lot more complicated than just like, let's set up an LLC and go do this.
Right, right,
Yeah.
exactly,
I can
exactly.
see where there's a bunch of pitfalls, and you need a really savvy lawyer to make sure you're not crossing your wires, right?
Yes.
Because all the documents need to
Absolutely.
align.
Yes. And I tell people I'm a healthcare attorney. I have a master's in healthcare administration and a certificate in health and hospital law. I've been doing this for over 20 years. If you don't want me, I don't know why you wouldn't, but if you don't want me, find a healthcare attorney, because I've had too many clients that just got a normal business transactions attorney, and I do that too, right? I can help you start your bakery, right? But without knowing those nuances with healthcare, you can really find yourself in a pickle later. And it's going to be more expensive to try to fix it than if you had just gotten with a healthcare attorney at the beginning.
I had a grandfather who decided to pass on getting his property surveyed before he chunked it out because of the price, and he spent a whole lot more fixing it later.
Yes, it's always better to spend that money up front. And if you don't, you're going to end up spending 4 or 5 times that on the back end to fix it.
Yeah, that's accurate. I think
Yeah,
that's about what happened.
yeah, yeah, yeah.
Back to the physician majority ownership. Why is it so important to maintain that? And how does it keep us in compliance with like the state laws and regulations around medical practice and practice management?
So, what if you are looking for a med spa? This is just as a consumer, right? If you want to go and get your Botox or your IV hydration or whatever it is that you want to do to make yourself feel better, when you are looking up the med spa, make sure there's a physician involved, right? If not, not only are they violating the corporate practice of medicine, like that's the easiest thing, but not the easiest, but that's like the
The
most
most
simple.
clear, yeah.
Right, the clearest violation. But if they do not have someone asking you those questions, right? Like the nurse can take down your history, a nurse practitioner can do a good faith exam, but you need someone with that education and training in order to make that diagnosis. Because I don't know about you, but I'm getting old and I'm on all kinds of medications, right?
Oh, amen.
Blood pressure, anxiety, like whatever. And so a medical doctor is going to understand, or a nurse practitioner or a PA is going to understand how all of those things are interacting. And it's not to say that a nurse doesn't understand that. I'm the daughter of a nurse. My mom is still nursing. She's been a nurse for over 50 years. But there's certain things that nurses can do and cannot do, right?
Right.
One of the things they cannot do is diagnose and treat. And so if you are on a variety of supplements, a variety of medications, those things are very important for that medical personnel to know in order to say, yes, you should have IV hydration, or maybe you should, but maybe it should only be this. Or, you know what, if we give you Botox or we do this, like these are the common complications with someone taking that type of medication. So there's so many different avenues that it goes beyond just being compliant with the corporate practice of medicine. Some of these things can really cause harm. They can kill you if you don't
Yeah.
have someone that knows what they're doing. It's more than just like your eye is frozen shut from Botox. If they don't know what they're doing, you can actually be really, really harmed. And that, I think, is the bigger picture in terms of trying to educate consumers.
Yeah, absolutely. So, can you walk us through some of the financial dynamics of the med spa? How do you structure it so the physician and the non physician partners all benefit in a proportional way and remain compliant?
Sure, sure. So typically what happens is that, and the way I explain this is that you have the clinical side and then the administrative side. And for people in the medical field, the clinical side is very clear. Like they absolutely knows what that means. But on the admin side, that's a little foggy, right? Because that's where you're going to have your MSO, and the MSO is coming in to only do the admin for that clinic or for that med spa. That is where the majority of the revenue is actually taking place because the nurse can own that outright, or I can own that outright. And
Oh,
all that means is that the MSO is going to contract with the med spa for all things administrative. That's not only the coffee and the donuts and the pens and the paper, but the EMR system and the advertising and the website, all of those things. The MSO can be reimbursed from the med spa for that. Okay, so that's
okay.
the first way. And typically that's anywhere from 40 to 60%. It could be higher, it can be lower. But those are things that you really want to think about and discuss because we want to make sure no red flags are being raised, right?
Yes.
And so that's the first thing. Then after that, with the medical spa, then we're going to have the medical spa employing that physician for those services. Then we're going to have the medical spa employing that physician as a medical director. Every hat that a physician wears, there should be a contract. It's the only
Okay.
job that I know that you can keep piling on stuff and there has to be a new agreement, right? If it were
Yeah.
me and they're like, take out the trash, do the windows, that's just a part of your new job description. You're not getting 50 cents more an hour because to take out the trash. It's not that way with physicians, okay? So for every hat that that physician is wearing, there needs to be a contract and there needs to be a rate structure. And then after that, you can hire your nurse to be an independent contractor through the medical spa to put in the IVs and to do all of those types of things. Something that I think is important to mention is that those good faith exams do not have to be in person. I think that's
Oh,
another misconception. The good faith exam can be virtual, just how we are. Telemedicine has really exploded a lot of that.
yeah. That was one of the beautiful things from
Oh,
COVID.
it's great.
Yeah.
It's great. And one of the benefits is that one of the hallmarks of it is that that physician or that nurse practitioner needs to lay eyes on you,
Mm.
especially if you're new, right? They need to lay eyes on you. They need to be able to ask you all of these questions and fill out the forms just as if you were there. Now, of course, if it's in person, that is the best thing. I would not suggest phone calls. That's kind of a slippery slope. To me, the best practice would either be in person or virtual.
Yeah, that makes sense. For those who aren't as versed, what's the downside to the phone call? What's the beginning of that slippery slope?
Well, that slippery slope, you're not able to put eyes on that patient. Once that physician patient relationship has been established, right? Like if you're coming back, it's 6 weeks, I need another IV hydration. They've already met you, they already know you. Right. But I need to make, as a physician, they need to make sure that you are who you say you are.
Oh, yeah,
Right?
I
Because I
suppose.
could pass the phone to someone, they do all the stuff, they give you a bunch of information, and it's just not as safe.
Yeah.
Are there exceptions to that rule? Obviously, of course. But I think best practices from a legal standpoint are having eyes on that patient.
So, what advice would you give to a physician who's considering opening a medical spa with a non-physician partner or partners?
I would say number one, of course, get a healthcare attorney. That I think is going to solve a lot of heartburn and headache later on. And then the other thing too is to have a really good understanding as the physician what's going to be required of you. I also tell a lot of my clients that this is really a side hustle for the doctor. This is not their main mode of gaining income. This is the Mary Kay, this is the selling the popcorn, and that's really how you have to think about it. So if you have a physician that's like, yes, I want $10,000 to be your medical director,
Yeah. Huh.
flags, right? Because it's enough of a bonus, it's enough of an incentive for them to partner with you, but they should not be making money hand over fist unless they're medical director for tons of different places, which that's a whole other talk show. But a whole other thing. So that I think is the biggest thing, is just to let them know that there are different avenues in ways in which we can have this done. Definitely healthcare attorney.
Excellent. And what are some of the key legal elements to keep in mind when you're negotiating like the ownership and revenue splits in a partnership like that?
I would say, like, what is everybody bringing in, right? Like, how much is that recipe worth versus how much is that equity worth, right? We got sweat equity and normal equity. And so what or financial equity. So
Right.
what is that worth? And it's really going to depend on that partnership, on that business relationship. Some physicians are going to want a lot more say so. But that, again, that does not mean that that 51% ownership equals 51% of the revenue, unless that's what you want. And if that's what you want, more power to you.
Yeah. As long as the numbers work for everybody, ain't it
Yeah,
great?
you love it. I like it. You like it. I love it.
Well, and I have to say, I have really loved this conversation with you
Thank you.
today. Thanks for joining us for Red Flags with Elissa Brewster. And you can find her at Brewster Law tx.com. Please like and subscribe and leave a review so that other people can find this valuable information. Helps us with that YouTube algorithm. And come on back and see us, y'all.
Thank you.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.